Hey everyone, welcome to Smart Course, the go-to place for authoritative information and strategies for special needs and learning disorders, especially ADHD. Today we're going to discuss impulsivity, forgetfulness, and fatigue in ADHD children, as well as a few tips for educators to use at school and for caregivers to use at home. All of the information and recommendations in this video come from Adhd magazine, CHAD, and Science Daily. First, we're going to describe impulsivity, forgetfulness, and fatigue, and then we'll go over some tips to implement, so let's get started. We'll start with impulse control. This is the ability to stop and think before acting. So children, particularly those with hyperactive presentations, have trouble with impulsive behavior and have a tendency to act or speak on a whim because ADHD actually impairs a person's ability to stop and consider the consequences or outcomes of what they say or do. This can look like blurting something out without raising their hand, or even jumping off the jungle gym without considering how or where they'll land, or even just reacting poorly to frustration or embarrassment, like, punching or screaming. So things like that. And as you might imagine, these can affect their relationships as well. Now, this seems like something a lot of people have challenges with, but let's look at how ADHD brains and non-ADHD brains compare. We're going to focus on the thalamus, frontal cortex, limbic system, and the hippocampus. The thalamus is located near the center of the brain and controls response inhibition. It sends signals to stop or allow behaviors. The frontal cortex, surprise, surprise, is the front area of the brain and is like the control center of the brain that handles emotional expression and problem solving. The limbic system deals with emotion and memory, and it's located on both sides of the thalamus. The hippocampus is part of the limbic system and deals with emotions. In 2017, Dr. Martijn Hoogman, with a PhD, led the largest ADHD MRI study to date at Radboud University Medical Center in the Netherlands. This international study measured the differences in the brain structure of 1,713 people with a diagnosis of ADHD and 1,529 people without ADHD, and the participants' ages ranged between 4 and 63 years old. This study found in ADHD brains, the region that I mentioned before, among a few others, are slightly smaller than those in non-ADHD brains. This study was pretty groundbreaking because it helped confirm the neurobiological basis for ADHD and confirmed differences in those brain regions correlate to common symptoms of ADHD. But there's definitely so much more to discover that definitely doesn't tell the whole story. This means kids who may struggle with withholding comments or reining in short-term desires like eating candy or spending money, and part of why they struggle is because ADHD brains are structurally a little different. Another way to visualize this is kind of like the Stanford marshmallow experiment. A child with ADHD probably would have eaten that marshmallow right away because outcomes, like especially delayed ones, are difficult to recognize. Here are 3 tips for impulsivity at school. 1. Discipline should be immediate. If a student pushes another or says something unkind, have them sit out for part of recess or don't allow them to participate in a fun activity. Delayed consequences don't really work well for students who have difficulty anticipating those outcomes. 2. Try filling out a daily report card for the child's parents. This allows you, the child, and their parents to monitor progress. 3. Set clear, enforceable expectations. Write down a schedule together, then erase the activities once they're completed. This helps provide and maintain structure while also giving kids a sense of control over their day. Here are 3 tips for impulsivity at home. First, anticipate potentially explosive situations. Things happen, even amidst a well-structured routine, but being aware of potentially upsetting circumstances and generally having a backup plan for your child's behavior will definitely make things easier. Prepare your child for special occasions and be clear about how they should behave. Come up with a signal to use when things are getting overwhelming or if you sense a meltdown. 2. In general, be clear about how your child should behave. Don't just say, be good, but explain what good behavior looks like. Is that waiting for their turn during an activity? Is that not interrupting? Explain exactly what good behavior is. 3rd, hold your child accountable for their actions and make them immediate. Quick timeouts or something of the sort should directly follow poor behavior. Help them understand they are responsible for their own actions and behaviors. Next up is forgetfulness. Children with ADHD have trouble with working memory, also referred to as short-term memory, and this is the ability to keep information in mind so it's available for use. This kind of information is more temporary and easy to forget, This kind of memory is usually used for following directions, applying new information, reading comprehension, completing tasks, anything with information you need to recall fairly quickly right after learning it. It's kind of like learning someone's name for the first time. Children with ADHD also have trouble with retrieval, or recalling information that has been stored away for a while in their long-term memory. If your child or student seems to have trouble doing something they've previously done well before, this is probably why. This challenge also makes it really frustrating and difficult to build on previously learned skills and information. Here are 3 memory exercises for recollection. First, try practicing an activity. For example, practice copying down homework before the first day of school, so the first time they do it isn't when it really matters. Second, provide a count for things they're learning. An example is prompting them and saying they'll learn 10 new vocabulary words, 5 are nouns, and 5 are verbs. Something to help keep them on track. Third is to aim for comprehension. This one is a little more hands-on and it takes more time, and it focuses more on long-term memory. If there's a book, blocks, or some other physical representation of what they need to learn, let the child engage with that before simply writing it down. For instance, does your child understand math in pictures? Draw pictures to help make the concepts a little clearer before you thoroughly explain it. Last up is fatigue. We all know this. It's pretty synonymous with being exhausted, low energy, and you get the gist. Thomas Brown, a longtime researcher of ADHD, was one of the first to give and bring attention to sleep disturbances as a direct manifestation of ADHD in both children and adolescents. Sleep disturbances generally appear around age 12, but clinicians were looking for symptoms around age 7 until the 5th and most recent edition of the Diagnostic and Statistical Manual of Mental Disorders raised that age to 12. These sleep disturbances can look like trouble falling asleep, staying asleep, and waking up. The ADHD brain has challenges regulating functions pertaining to activation and arousal. This leads to overstimulation and eventually chronic tiredness and fatigue. Plus, it doesn't help how nighttime is actually pretty optimal for ADHD brains because it's quiet. There are few distractions. It's calm. However, because kids have school the next morning, that optimal nighttime is used for rest to prepare for the next day. Here are some tips for sleep. First, find out what your child sleeps well to and stick with that. Maybe that's a snack before bed, or white noise, total silence, maybe a nightlight. Whatever helps your child sleep, and stick with that. Second, your child should only use their bed for sleep. And this helps with what the brain associates with sleep as well as building that habit. The bed should not be a location for conversations or arguments, not for playtime, not for movies. Sleep. Use the bed for sleep. Third is to be strict with sticking to a bedtime routine. Sleep disruption means your child may not have a set circadian rhythm just yet, so establish a sleep routine to help establish a rhythm. Also, sleep medications are an option, but consult with your doctor first. In our upcoming video, we will be learning more about some of the benefits of ADHD. For an expert-curated list of resources from our past summit and videos, in particular WebMD, Natural Remedies for ADHD, please visit the link in the description. If you like this video, please don't forget to like it, and let us know what you liked or what you'd like to see more of in the comments below. Also, don't forget to subscribe and hit the notification bell. The more people who like, subscribe, click the bell, and comment, the more people will see this kind of information on YouTube, and we know some people could really use this help. We share tons of expert-vetted resources on parenting and education for differently abled kids, so feel free to sign up for our newsletter using the link in the description below. If you haven't watched our previous series about ADHD and other disorders, click the annotation to watch those videos. And if you want to support SmartCourse and help make sure we can continue bringing you content, check out our Kickstarter and membership pages. We also have an online course with even more specific information, step-by-step guides, and access to professionals who can help you through this process. As always, I appreciate you taking the time, and thank you for watching, and we'll see you soon!